Hello everyone, welcome to my channel. And after a long period of time, I have brought a new video. I hope you will be attentive in my class and you will learn whatever I am teaching you in a very short and simple way. So I hope you will understand my lecture. And if you are not understanding anything, then you can put your comment in the comment section below. So let's start the video. So today's topic is principle of community health nursing. So, first principle, here it is written, community health nursing services must be based on the need of the people. That means whenever we are giving any service in a community, there should be a need of the people. That means, for example, if a patient is suffering from fever, we have to give the management of fever. We cannot tell them regarding the diarrhea management, right? So, it should match their need. कि उनको फीवर हो रहा है, that's why you are giving fever home management. So it should be the based of on the need of the people. Second one is community health service must be planned and purposeful. So whenever you are going to the community, it should be very much thorough in your mind that what you are going to do, what is your plan. Whenever as soon as you enter to the home, what you are planning, how you are going to take the history, how you are going to find out their problems, how you are going to prioritize it, and if you are finding any kind of problem or any kind of diseases, what are the health education you are going to give them, what are the procedures you will do for them. So everything should be planned and purposeful. Clear? Third point, good IPR between nurse and key persons are essential. So, where as soon as you go to the home, you should build a rapport with the family members. Otherwise, they are not going to give you the information. That one should be thoroughly, you have to understand that they have to trust you before you ask something to them. So for that you have to build the IPR. IPR means interpersonal relationship. I'm giving you example, okay, so that you can understand. The next is community health nursing services must be continuous in nature. So what do you mean by continuous in nature? That means whenever you are going for the home visiting, today you if you are going today, then again day after tomorrow you have to visit that family. Again after 3 days you have to visit that family because you have given the health education, you have given the treatment. So you have to see, whether the uh, person or the family got recovered or not from that particular diseases for which you have given the health education. So for that continuous nature in nature, excuse me, continuous in nature is important. Community health services should be provided irrespective of age, sex, economic status and religion of people. इसका मतलब क्या है कि whenever we are giving any service to the family, you cannot say that okay, she is under 5 children, I will not give care to that particular individual. She is female, so I am not going to touch her. She is economically very low or sounds weak, so I am not going to treat for her. She is poor, I am not going to treat for her. She is Muslim, she is Hindu, I am not going to treat for her. You cannot do that. You cannot do that. So that's why this point is telling that community health service should be provided irrespective of age, sex, economic status, religion of people. Irrespective of मतलब एज जो भी हो, सेक्स जो भी हो, इकोनॉमिक स्टेटस जैसा भी हो, religion of people जैसा भी हो, you have to give proper care to that particular family. Understood? The next one is health education is an integral part of community health nursing. So, health education, whenever you are going for the home visit, health education is very, very, very important. That one you have to remember. Health education means suppose किसी का fever है, you are explaining them about the management of the health, management of fever. मतलब घर में ही fever को कैसे manage कर सकते हैं उसके बारे में अगर तुम उसको समझा रहे हो, that is called health education. Okay. Next is community health nurse is an important member of health team. So they are saying that yes, definitely, because health team का सब लोग ही health team में कौन कौन आता है, doctor, nurses, lab technicians, radiologist, pharmacist, so many of them are there. So among them, community health nurse is also plays a very important role. Next point is community participation is an unavoidable aspect of community health services. So इसमें क्या बोला है कि if you are giving health education or any health services, कम्युनिटी पार्टिसिपेशन इज इम्पोर्टेंट. मतलब जो भी जगह पे तुम जाके हेल्थ एजुकेशन दे रहे हो, उस जगह का लोगों को तुमको सपोर्ट करना होगा. देन ओनली यू कैन give proper care to that particular family or proper care to that particular community. So community participation मतलब उन लोगों का cooperation is very very important. Next point is community health nurse should not accept any gift or money as bribes. So क्या बोलता है यहाँ पे कि अगर इफ यू आर सपोज गिविंग सम प्रोसीजर, इफ यू आर डूइंग सम प्रोसीजर, अगर किसी का तुमने यूरिन एनालिसिस करके शुगर चेक कर दिया है, तो शी इज़ वेरी हैप्पी एंड शी वांट टू गिव यू मनी, मीन्स कम्युनिटी पीपल और सम family wants to give you money. So if you are taking that, then you are, it is illegal, you cannot do that. You cannot accept any gift or any money from the पर्टिकुलर फैमिली, क्योंकि गांव में जाने से भी ऐसा होता है कभी कभी कि वो लोग आपको खुशी से कुछ मतलब देना चाहता है, तो वो आप नहीं ले सकते, बिकॉज यू आर अ प्रोफेशनल, हेल्थ प्रोफेशनल, सो यू कैन नॉट टेक दैट. देन supervision is an supervision and evaluation is the chief component of community health services. So supervision and evaluation is the chief component. Matlab, whenever you are giving any care, any health services, you have to supervise properly. You have to evaluate whether your the way you are giving care, the way you are giving health education is proper or not, whether it is effective or not, whether it is helpful for the people or not. You have to supervise, you have to evaluate that. Okay. Then community health nurse must be a full-fledged nurse. So you in community sector we can see nowadays that community health officers are there who is fully committed to the community people. Okay, so for that they are saying then only the care will be good in the community. Then only home families will get a proper health educations from that particular family. So these things we need to understand. Okay, then the individual and family are basic unit of community health services. Individual and family are the basic unit of community health services. इसका मतलब ये है कि whenever you are giving any health care to that particular community, उस कम्युनिटी में जो फैमिली होगा दैट इज योर मेन प्रायोरिटी, एंड दैट पर्टिकुलर इंडिविजुअल इनसाइड द फैमिली इज योर मेन प्रायोरिटी. That's why it is called a basic unit. Means for them you have to focus on that particular thing. One is your individual, that particular person, and the next one is the family. सो मेडिकल सर्जिकल में क्या होता है कि हम लोग नर्सिंग केयर प्लान लिखने से भी हम लोग ओनली वी आर फोकसिंग ऑन द इंडिविजुअल, वी आर नॉट राइटिंग अबाउट द फैमिली. बट इन कम्युनिटी, whenever you are going for the home visiting along with the individual, you have to wholly matlab focus on the particular family, and accordingly you have to prioritize the problem and you have to write the nursing care plan. So this is all about the principle of community health nursing. I hope you have understood. If you have any confusion, you can please put your comment in the comment section below. Thank you so much for listening. Thank you.